dim the lights here in the physical world. Okay, this is MED120. This is week 9. Next week is week 10, our last week. Yay! If you guys weren't on mute, I could hear your collective happiness. So, and everyone's doing really well. If you're not doing well, you probably already have emails and got a call from me. But overall, the class is doing quite well, which it should. And today is March 1, week 9. And what are we doing today? Go all the way to the end of the modules. And for those of you who had some medical language lab issues, you guys recovered nicely. And you could see that your grade was adjusted accordingly. Now, everyone in the next week, check all of your grades to make sure they are accurate. But again, like I said, if I give you a 100 when you deserve the 0, just keep your mouth shut, okay? But if I gave you a 0 when you deserve the 100, please call me, text me, email me. Do what you need to do, okay? All right, so I see now there are 9 participants plus 2 in the house. That's 11. 11 plus me, 12. Okay. I will again check attendance again. So what are we doing today? Now, this is really weird because Module 9, I don't know why, they did integumentary system. And I'm on the, what's this committee called? I'm on the curriculum committee. So we'll be changing that because, you know, in theory, skin, should be up first. And we're also doing eye and ear. So let's jump over skin and let's just do eye and ear. And then I will put an extra, because a lot of you did the integumentary system already on your medical language lab, actually. But let's jump to chapter 11, eyes and ears. So let me, again, I picked the wrong thing. I always have to pick, what is it, Firefox? Where's my Firefox? There it is. Not now. So when you guys do your assessment of me at week 10, it's at the end of your Moodle page. You could say, he's always not choosing the right thing. Give him minus 20 points. I don't know, whatever points they have. But again, I have to stress that if you're to critique, whether it's me or anybody, whether you really love me or really hate me, it's inconsequential. The professors need actual feedback, need comments, okay? Like, oh, I don't like him. Okay, fine, all well and good. But I need to know exactly why. Like, he goes too fast, or he tells too many stupid stories that don't match with this lecture. Those are just some examples. Please don't copy those, right? But you know what I'm saying? So that your student voice can be heard, and that we have a lot of ego-free professors on this campus. So if you say something, they'll adjust. And I've been trying to adjust better with my stories, but it's kind of rough. But I've been working on it. I've been pretty good, actually. Yeah, but sometimes it makes the class a lot longer than it should. And then I start talking about stuff that I really shouldn't be talking about. Right? Because you all know there are 2 kinds of Marines. One, they'll never tell you a damn thing. I'm the other. I'll tell you everything. Hey, you want to know about my deployments? Yeah. Here are the ones that are still classified. Let me talk about it. My son's one of the quiet ones. He'll never say squat. He says he was going to be home this week, and I didn't know what that meant. But let's see. Cross our fingers and toes. Okay, so now we're at chapter 11, and that's eyes and ears. And the specialist who does the eyes is the ophthalmologist. Now, the ophthalmologist, Logi study of, ophtha, and look at the spelling. There's an extra H in there, okay? Now, that person is an MD, the ophthalmologist. They're the ones who do the diagnosis, the treatment. They went to medical school, and also that's a partial surgical service in ophthalmology, okay? But they also work with the optometrists and the opticians, and those are the professionals. They're not MDs, but those are the professionals that what do you call that? That make your lenses. Okay. They also do the measuring as well for your lenses, because not only do they have to look nice, they have to also fit nice. Because if your glasses don't fit well, it's just like medication. The patient won't wear them. If they don't look good, the patient won't wear them, and then it causes a whole bunch of problems. So ophthalmology, that's the MD, okay? The optometrist and the optician, they're not MDs, but they're very important because they're the people who make the corrective lenses and contacts for you. Otorhinolaryngology, or this is otolaryngology, but it's otorhinolaryngology. That's ears, nose, and throat. So you have the otto, it even looks like ears, right? Larynx, we know, is our voice box. Rhino is our nose. So you put it all together, that's ENT, right? And they are MDs and they are subspecialists. And they too, they not only deal with things medically, they also deal with things surgically. ENT is a partial surgery, not partial, who am I kidding? A lot of what ENT does is surgical service. Because if there's like obstructions in your ears or your nose, your throat, we got to go in there and we got to go do things about it, okay? Now, the audiologist, when we're dealing with your ears, is not an MD, but they're the person who does, they're the professional who has training, who does the assessment for the ears. They're the ones who do these tests called audiology, or the study of hearing. And without their numbers and their assessments and their little creepy little charts that why did I say creepy? Because maybe my audiologist, when I was in training, she was a very creepy woman, right? I need those charts. I don't know how to create those charts, nor do I know how to play with that machine, but the audiologist knows how to do that. And they're really good. We're working with pediatric and babies and adolescents, because many times on developmental delay, we don't know if it's a hearing problem. How many children have been labeled autistic or mentally retarded because they actually had a hearing problem, right? And that's actually one of the first things we assess when a toddler, maybe 1 or 2 years of age, they're not talking yet. That's the first thing we assess is their hearing, and we have to send them to the audiologist. And it's really neat. It's free. If any of you guys have like any family members who you're suspecting of that kind of thing, it's free, and you just go on their website and make an appointment. And then if there is a problem, developmental delay, suspected autism, any of those things, right? If it's not a medical issue and it's a developmental issue, then they get you hooked up with the the public school system. Both of my sons, I have one autistic child and one developmental delay who looks like another autistic child. We're not sure, but they were both diagnosed before the age of 2. So it's very, very, and the earlier the diagnosis, the better the outcomes. I have a nephew, CJ. He doesn't talk. He's essentially a 250-pound toddler. He's 18, 19 years old now. He's very, very dangerous. And last year, because he's larger than his parents and he's violent, he is now a ward of the state. But it's nice because New York State, they have an in-house caregiver, and they got a male, one who's big, who can handle him, because when a 240-pound young man wants Doritos, he's gonna get it. He broke, last Christmas, I was wrestling with him. I've been wrestling with him since he was a baby. Big mistake. He broke my glasses onto my face, and he just couldn't stop. And he's very, 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 very large. Now, when you look at the spectrum of my son, my 16-year-old, he is, because of these programs, he is hyperlexic, meaning when he started reading, I think he was 4. And why is that? Because he's been in school since he was 2. Not because he's any special, but if you get the diagnosis and you deal with things early, you can deal with it. And the audiologist and all these other people related to speech therapy and the speech therapist as well. They're not an MD, but they're very, very important people when you want to diagnose developmental issues. The earlier you get it. And those of you who have children, little babies, flood them with everything, right? Teach them every language. My cousin is teaching her little daughter 4 languages at once. Why? Because a baby can handle it. Before 6 years of age, your brain is pretty much a sponge. It doesn't get super solidified yet. So teach them the alphabet, teach them numbers, teach them calculus if you want, right? Teach them everything, because by the age of 5 or 6, once they get into school age, they come solidified. Didn't you guys ever wonder why you only let the kids into kindergarten and then first grade at that age? It's because the pathways in the brain are already solidified so that they can be now molded. But before then, they're a sponge. They soak up everything. My babies, all of them have computers, radios, TVs. Everything is on in every room. And all of my children are hyperlexic. They all, well, except the babies. I don't know the babies yet. Well, the 1-year-old, she's kind of creepy. She already is doing a lot of milestones for a 3-year-old. And why? Because we've been doing things to her since the day she was born, right? So you keep on doing that. And even beyond 6 years old, keep on, a lot of people say that, you know, pushing a child is detrimental. No, they can handle it. They can handle a lot more. And those of us who are in the public school system, it's really, really, I don't know, the public school system, they're like shooting for the lower bar. I'm a product of the public school system, and I could definitely say that they did not properly prepare me for college. So that's my little, I'm going to get off my soapbox now, but that's my little thing regarding, you know, child development and also your development. Just keep on putting stuff in your head, and it'll be advantageous to you, especially when you grow older. So let's look at some word elements. Blephar, that's your eyelid. Your eyelid is to protect your eye, and it has muscles in it. And sometimes you might have a little spasm. If you're ever tired, do you ever eye like twitch, or maybe you're really pissed off, or maybe you pissed off your partner and their eyes start twitching, right? Like they're about to snap. Well, that's a blepharospasm. It could mean nothing. It should mean nervous irritability, or it could mean pending psychosis. Who knows, right? Conjunctivitis. Well, you'll know. You'll know when the knives come out. Conjunctivitis. Now, your conjunctiva, right? That's like, you know, when you get pink eye, right? That's the itis. There's an inflammation there. You have a lot of red. You have a lot of arteries that get inflamed, right? You have most likely it's bacterial conjunctivitis, which is highly contagious. So if you have especially children with pink eye, wash their hands immediately and tell them not to touch their eye and not to touch other kids. And then you got to fumigate your house, because in a day, the other kids and the other people in the house will get bacterial conjunctivitis, also known as pink eye, as well. That's why when you get a little bit of eye irritation, the school sends your kid home. Your choroid, right? Well, the choroid, that is also a vascular layer of your eye, but it's like on the inside, and between your retina and your sclera. Now, your retina is a bunch of nerves, so this is not a good thing to have because it's way too close here to your nerves here, and that's choroidopathy, potato, whichever way you want to pronounce it. And you got these nice little, what do you call these things? Phonetic spellings here. Your cornea should be clear, okay? But it can also be inflamed. The neat thing about your cornea is that there's no real blood supply to it. So if you bash it or do whatever, I could rip it out and put you a new one, right? Which is really neat. But still, also known as keratitis, corneitis is not good because, of course, if the cornea is like the clear shield right before your pupil, right before your lens. If that thing gets all scratched up, you can't see very well, and that's not good. Anisocoria, this is bad news. It means there's brain damage. It's inequality of pupil size. That's why when the doctor dims the lights in the room, and then they cover one eye, and then they shine your light in your other eye, they're looking at the other eye to see if the other eye reacts the same way, because both your eyes are obviously connected. You'll if you recall your anatomy and if you're in anatomy and physiology too, we talk about how your eyes are always connected, right? If one looks at the right, the other one looks at the right. If they both look up, they both look down. They're not supposed to be looking different ways. And the pupil should shrink and expand, or the opening of your eye should shrink and expand the same amount in both eyes. If they don't, that's called anisocoria. It's a sign of significant brain damage or brain trauma. That's never a good thing. Choriometer, it's an instrument for measuring the pupil size. Many physicians, many ophthalmologists in their pen light, if maybe you guys have seen it. Why am I drawing it on my fingers as if you guys at home can see it? Sometimes on a light pen, you see this? You may have seen this design on a light pen. Those are in millimeters on normal to abnormal small or abnormal large sizes of your pupils. And you'll learn in anatomy and physiology why your pupils have to be big. Why do they have to be small? Why do you have to constrict light sometimes? And why do you have to expand light sometimes? You'll learn that when we're talking about autonomic nervous system. But pupillary contraction and choriometers used to measure, how much the pupil is opening and closing. And remember, it makes sense. If there's a lot of light in the room, do you need a lot of light to get to your retina? No, so your pupil should close a little bit, like if you're outside or if there's a lot of light going in your eye. But right now, for example, in this classroom, I shut off some of the lights so we can see the board, right? Your pupil should do what? Open up a little. But according to the autonomic nervous system, auto meaning self, you have no control over yourself, right? It's all on automatic or autopilot, right? Someone told me if you smoke weed, something changes in your eyeballs. I've been told, right? And of course, that's your parasympathetic nervous system. So what's going to happen? Your pupils will go smaller. But if you take, amphetamines, let's say you took a whole bunch of Adderall when you shouldn't have, right? Your pupil will go whoop, whoop, get really big. And it makes sense because sympathetic nervous system means what? Fight or flight. If you're running away from something or if you're in a fight, wouldn't you want to see all the punches coming? Wouldn't you want to see all the avenues of escape? Yes. So that's actually how I remember pupillary size and whether it's supposed to be big or small. But remember, they all have to be big and small together. Diarrhea, that's excessive secretion of tears. Lacrimation or hyperlacrimation, it's the same thing, right? So your lacrimal gland is the gland in the upper outer portion of your eye that releases tears. And you'll learn in anatomy and physiology, your tears are really important. It's not just water. It has a ton of enzymes in it to kill things. Because have any of you ever looked at the sun and you blink your eyes real quick and then there's little buggies or little things floating around? Yes, because there are things on your cornea that are floating around that your tears just washed away, right? And your tears have enzymes to make sure those things get dead and don't, mess up your eyeball. Your iris or iridoplasia, paralysis of the sphincter of the iris. So that's when you are unable to shrink and expand your pupil. And we sometimes use drugs to do that so we can do some things to your eyes. Keratoplasty, we were talking about the cornea. I could take it. I could take it out and get you a new one, and that's called keratoplasty, because kerat means hard or strong, right? And that's what our cornea is. It's this hard, clear structure that covers our pupil, that covers that is the initial covering of our eye. Ophthalmoscope, it's the instrument to measure the eye. You know, that's that annoying little. Why am I doing that with my hands again? Let's just show it. Jeez. Also known as part of your diagnostic kit, your ophthalmoscope. That's the thing that looks like this thing. Now this thing, this is your otoscope. This thing is your ophthalmoscope. These things can run like a couple $1,000. Okay, so if your doctor lets you like hold it and clean it and whatnot, please do not drop it. I've done that once or twice. Oh, and second year residency, my mother gave me her diagnostic kit that she had when she was a resident. And a little side note, you're in the hospital, treat it just like the mall. Would you leave something that's worth $1,000 on a bench in the mall? No. So why did stupid me leave a $1,000, what do you call it, old school 70s Welsh Allen kit in a room with a patient I don't know? And when I went there, when I talked to the patient, I talked to housekeeping, no one knows where it is. And that was this is back in the early 2000s where there's no cameras or anything. And I can tell you right now, all the cameras in the hospital, the people who take stuff know where all the cameras are, okay? And do not be surprised if it's another faculty member or it's another person on your staff. Because when I did my my Scooby-Doo sleuthing, it got down to either it had to be a nurse or it had to be a surgical tech. They were the only two people unaccounted for. And both of them, everyone else like, oh yeah, they had stories where that person went in a room and something disappeared, right? Even I had emergency surgery once, and I put my watch, a watch, it wasn't that expensive, but it was engraved from my father saying, you know, good job that I graduated medical school. And I was only in the emergency surgery 17 minutes. And it had to be a surgical tech. It had to. There's nobody else in the operating room except what? The nurses who were in there with me, the surgeons who were in there with me, right? So who else is walking around in an OR that's secure? A surgical tech. And the surgical tech swears up and down. Oh, I didn't see it. I don't know what you're talking about. I wasn't the only one who was robbed that day. The other doctors, they lost wallets and cell phones and whatnot. Oh, they cleaned us out in 17 minutes. All right. So when you're in the hospital, you just be smart, lock everything up, put it in your locker, carry it on your person. All right. I just keep on learning lessons the hard way. Optic, of course, your optic nerve. It's the nerve that deals with your vision, with your eye. Retina, that's the cameras. Those are the sensors that pick up light, that sends electrical signals to your brain. Now, did I tell you that the retina sees anything? Does your eye ever see anything? No. So I'm going to freak you out a little bit. But those of you who already had me in A&P already heard this. Your eyes don't see anything. All they do is pick up light. They send electrical signals to your brain about how much light is coming into your eye. Your brain does the rest. That should either excite you or scare the bejesus out of you, right? Because when I learned that when I was in undergrad, it kind of freaked me out because it was one of those moments where I realized, wait a minute. So when I look in the mirror, right, and I think I'm good looking, that could be an entire machination of my ego and my mind. That's scary. Or when I see somebody, when I see somebody who looks god-awful to me, they probably are the most beautiful person, but my brain is not telling me. And also, how many of us had hallucinations, right? How many of us have children and maybe you let your kids to grandma's house for a couple of days or so? Don't you hear them? I hear them. I can hear them as when I miss my children, I can hear them, right? And you're like, huh? And I'm like, I'm not crazy. I heard it. I saw it. So your retina picks up light. That's all it does. It is your brain that does the rest. Scleritis, that's the whites of your eye, and you can also have an inflammation of that as well. Opia, vision. So presbyopia is, right now, I got to wear glasses because I'm getting older. Presbyopia is what just happens to your eyes. The human machine tends to break down and tends to need repair as it gets older. Amblyopia, reduction or dimness of vision, right? And that's also part of presbyopia because when you get older, you're not as, you're not as efficient as you were. When I was 18, 2,000 yards iron sights, I could hit what I need to hit. Now, I'm lucky if I hit anything, maybe 60 yards, 70 yards, and I've been shooting since I was 12. But I better wear my glasses at night or I'm hitting something. Heteropia, inequality of vision. Some of you who have glasses, like I have glasses, my left eye is like a train wreck. There's all stuff going on. My right eye, not so bad. And that is heteropia. Hetero meaning what? Different. And you typically, a lot of people, both their eyes don't have the same level of pathology. One will be stronger than the other. One will have more damage than the other. Blepharotosis, drooping of the upper eyelid. Now that could also mean maybe the person's on drugs. Maybe the person has a neurologic. Maybe also there are certain metabolic disorders like thyroiditis and hypothyroidism that can also produce drooping of your eye. So if you see somebody who looks sleepy and droopy, again, we cannot assume if it's drugs, it could be metabolic, it could be neurologic. And again, we have to go through our whole rigmarole to find out what it is. And it's the downward displacement or the drooping of the upper eyelids. And it could be for a number of things. Hypertropia, also known as strabismus, right? It's an ocular deviation. One eye is, does anybody remember like Beverly Hills 90210 with Shannon Doherty? Oh, geez. Am I that old? Well, she had like, sometimes when you look at people, you ever look at somebody like one eye is like a lot higher than the other one? Right? You ever meet anybody like that? Am I the only one? Well, no. Am I the only one who meets very different people? Well, that's hypertropia, this ocular deviation, also known as strabismus, right? And then like you'll see like one eye is like, it's off. Because typically when you all look at each other, your eyes should be pretty much on the same plane. But there's some people, one's a little higher, one's a little lower. It happens. And it could be from damage. It could be from a whole bunch of other things. Now, this lovely picture, this is beautiful if you're in my Anatomy and Physiology 2 class. And if you are, you know this because it'll definitely be on the exam, right? But we're just medical terms, so we got to focus on the terms. Oh, if you look at here, right? Do you see what he's doing? All right. Why does she look like Katherine Heigl? Right? Do you see what he's doing? He's putting his hand there, and you do that to make sure that you don't kiss or you don't bump into each other. And do you notice that his right eye is on her right eye? Because if his right eye is on her left eye, then that's a sexual assault charge coming at you. All right. So when you look at it, the right eye looks at the right eye, and then you switch. Left eye looks at the left eye, and then I put my hands. And this is of course pre-COVID. Nowadays we mask up. We have a visor on, and we're also gloved up. I just had this done a couple of months ago, and it was annoying, but my ophthalmologist had to wash his hands every time he stepped out and came back in. It was like 3 times, and I'm looking at him like, I'm okay, just keep your gloves on. And he was like, no, this is the protocol. And he goes, new normal. Ooh. I hate when people do new normal. Oh, how about this? Fudged up normal, right? So this is, now, not only the ophthalmologist does this, neurology does this, IM does this, because also this is a really good diagnostic tool for diabetes. Because if you're diabetic, you get these things called cottonwood spots on your retina. which is no bueno, right? And your blood sugar could be normal. And if I see Cottonwood spots, guess what? You're diabetic.
What do they look like?
Like cotton, like these little wisps of like, oh, why am I trying to explain it?
Can you see it without the optimus?
No, you can't. You need the ophthalmoscope because you got to see inside. Bingo. You see here where it looks like if I looked at, you'll see these extra blotches. And because you will also learn in anatomy and physiology and your pathology class, too much sugar is a bad thing. It's the analogy is that, you know, when you go to the gas station, right? You only fill the gas tank up to full, right? Now, and it has to be inside the gas tank. Well, diabetes is taking the fuel and then spreading it on top of the hood of your car, on your seats, you know, maybe dabble some of it on your kids, just to show them who's boss, right? So sugar in the inside of the cell is beautiful. It's used as fuel, makes ATP, makes us go. But sugar on the outside of the cell will damage things. And those Cottonwood spots are retinal damage, retinal neuropathies, nerve, pathy, disease. By the way, uncontrolled diabetes, once you have that diagnosis, time is ticking. If it's still uncontrolled within 5 years, you will go blind. My father did it in 4.5 because, you know, he's a go-getter. When he was alive, he was a go-getter. He wanted to be first. Question.
I do. So would that be like type 2?
Now, either type 1 or type 2, it doesn't matter because you'll learn in an, I keep on saying that. I got to stop that. You will learn. Well, type 1, just for everybody's consumption for today, type 1 diabetes is called insulin-dependent diabetes mellitus. That's the one where you're typically born with it, right? And it's insulin-dependent. So we give you insulin, or and we do all these things for you, right? And because the problem is you weren't born with enough insulin. And that's why the sugar is floating around all the place, because the insulin is the thing that opens the door to get all the sugar inside, right? Now, if you're type 2, non-insulin dependent diabetes mellitus, the problem is you ate so much Doritos or you did so many bad things to yourself that the key, because think about it, we all eat, right? Especially Americans. We as Americans, we eat way more than we should. Me, if I'm uncontrolled, I'll eat anywhere 6,000 to 8,000 calories per day if you don't stop me. Right? Now I've got it down to like 2,500, 2,600, around there. Actually, my dietitian says I should be around 1,000. Man, half my sandwich is more than 1,000, right? But these are the things that we just have to do as, because, you know, as people in this first world of ours, because this is the land of plenty, right? So this extra sugar does so much damage that the key that opens the door gets damaged. So just like any key, just imagine if I keep on using insulin, right? I kept on eating Doritos since I was 3, which I think I've been doing, right? And now I'm 53. So what happened to that key? In, out, in, out. I keep on, the lock is now broken. So that's why non-insulin dependent diabetes mellitus, it's not the key, insulin, it's the lock or the receptor that won't open the door. But ladies and gentlemen, the thing that I've always said before, exercise opens the back doors, and there's 2 of them. So if you exercise daily, just 30 to 45 minutes, or at least 20 to 25 minutes, where your heart is at maximal impulse, where you're actually doing work. Don't be one of these jokers in the gym. This guy was talking to me about stocks and whatever. I'm on the treadmill dying, and he's like, hey, you know, right? I go to the gym not to make friends. I go there to burn and then get out because I don't like taking meds, right? So, but if you do that, if you exercise, and it doesn't necessarily have to be the gym or something you love doing, like my mother, she does gardening. My wife, she does Zumba, right? You start burning things, the things that you like to do, then it opens the back door, and then sugar can go in the back way, right? So it doesn't have to. And insulin, yes. Insulin, if I do too much, I could bottom out my sugar and I could go into a coma. That's why you shouldn't, you want to, that's that guy, Klaus Van Bülow. Again, I am, oh my God, I'm dating my, in the 80s, there's this guy, Klaus Van Bülow, and he had this heiress millionaire wife, Sonny, who was diabetic. Klaus Van Bülow for 20 years has been giving him the same injections. He overdosed her with insulin and then killed her. She went into a coma and died, right? And she killed her. And he claimed that, oh, I made a mistake. You've been doing her insulin for 20 years and you made a mistake with a couple of $100 million in the bank? Oh, I'm going to make that mistake. Well, my wife doesn't have a couple million. Or maybe she does. All right. Oh, wait, is this on record? Oh, I better be careful because y'all don't know the missus. She's a go-getter. I might have some insulin in when I get home. And she is a medical professional and went to third year nursing, so she did have her pharmacology 1 and 2. Oh, by the way, you will start learning stuff about poisons, about things like that. Medical professionals know a lot of stuff. Now, remember we talked about opia, right? Emetropia, that's normal. Now, do you see this? The light rays, not really the object, but the light rays have to fall right on the retina. Now, if you're nearsighted, it falls short, and that's myopia. If you're farsighted, it falls too far back. That's hyperopia. So either way, if you're nearsighted or farsighted, things are gonna be blurry. Or you could be like me and have astigmatism. You notice here that the shape of the eyeball is a little off. Maybe it's all those years in martial arts and MMA. Probably bashed up my skull on my left side. That's why my eyeball probably don't look too good. So I have astigmatism left. And you can see now, what does it do to the image? The image is now all over the place. And remember, light rays have to end up where? In the retina, back here. The retina acts like a light ray camera, and then it sends electrical signals here into the optic nerve. And then your brain interprets what you see. Right? Yeah, that should freak you out a little. Right? So everything you see, you hear, you feel, you touch, you taste is not real. Your brain made it all up. Right? So if you think something tastes gross, it's your brain saying it. Right? I remember when I was in 6th grade, my father gave me my first beer and I went, ew, that tastes yucky. And then in just 3 short years, oh my God, anyone bringing beer to this party? I just need me some beer. Question. You got a question? Oh, no. All right. Okay. So, yeah. So I freak you guys enough. You're going to be freaked out enough when you're in my anatomy and physiology. And here, the same thing. We always think that the lacrimal gland is here. This is the lacrimal duct. Here is the lacrimal gland. Because it makes sense. Like if I've got a lot of schmutz here in my eye, right? When I blink, this thing will then drip all the tears, and then it will go down the eye and then end up in here. So when you have too many tears, this thing will back up, and then you start crying. Right? And we're one of the few. I think we're one of the few or the only animals that cry with respect to emotion. Someone. I think one of my fraternity brothers told me that.
Don't cry from emotion?
I don't know because I had stupid dogs growing up, so a lot of people had smart. All you students tell me about how smart and interesting your dogs are. No, I didn't have that experience growing up. That's why there are no animals in my house. All my dogs were just dumb as posts.
They all cry.
Yeah, like I've seen my dogs cry, but it's like, what?
Yeah.
You know, like maybe you're crying because you're stupid. Who knows? But to this very day, my children sees pictures of me when I was a kid, and they're like, "When are we getting a puppy?" And I go, "When they fly, they go grow wings. Yeah, they grow wings. We go get one." Right? My sister's the exact opposite. My sister has a small zoo, and she rescues things like Rottweilers and pit bulls. And she raises them, and they're the only things that she trusts, and my children. But those things hate me, right? Especially Snowflake. Snowflake has specific training because that thing used to fight in Los Angeles, on these underground places. That thing ripped apart 2 dogs in their neighborhood, and they had that court order to get to him to go trading and stuff. That dog looks at me like lunch. And when it's on its hindquarters, I'm not a large person. You guys, some of you guys saw me, right? I'm what, 5'4", right? 5'4" ish, right? When it stands on its hindquarters, it is taller than me, and it weighs more than me. It can open. You guys have dogs who can open doors. Snowflake can open doors, jump fences, and
his name is Snowflake.
yeah, yeah. It's Snowflake because it has a little vitiligo on its butt that looks like to my sister, looks like a snowflake. And my children, all when they go to the house, ride that thing like it's a horse. Me, I'm definitely afraid of it because it wants to kill me. Like, it's so happy to see everybody. It licks my wife's face and jumps on top of my babies, and then it looks at me like, and it's well trained so it doesn't growl. And he's bitten me more times, and then no one believes me. Like, oh no, he's not biting you. And I go, oh, so this blood here is fake. Oh, okay. All right. Remember we talked about hearing, right? Sometimes we have auditory hallucinations. Remember I said, so those of you who really miss your kids, you'll hear Papa, Mama, huh? Right? They're out of the house. I'm happy. But why do I still hear them? Because remember, everything that you hear, you're only hearing what? Sound waves. And the interpretations of those sound waves are your brain. Remember that thing a couple of years ago? They put it on Facebook or Instagram. Like, they played something and half the people heard one thing and then half the people heard another thing, right? Like, one was, I forgot what it was, happy birthday. Yeah, one was happy birthday and the other one was go fudge yourself. I don't know. Whichever it was, right? My friend's like, oh, which one did you hear? And I'm going, it's just like you have optical illusions, you can have also auditory illusions. So be careful when you're in the ward. Always double check on what you heard, okay? Because it's very, very easy to put an, which is a prefix of what? No or not, in front of something. And also, of course, document it. So you could have an acoustic problem, which is a hearing problem. Of course, the audiologist will use an audiometer. That's a nice little measurement of your auditory capabilities, right? And it's measured in decibels. Now, as a DJ for what, 30 years? And since I'm right-handed, my monitor is always on the left side, right? And also my headphone is always in my ear on my left side. So is it any wonder that there's a 40% reduction of hearing in my left ear? There isn't, right? So because all those years, boom, 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 right in my left ear. Maringo, your tympanic membrane or your eardrum, right? You can have, it might be destroyed where I have to cut into it, maybe release some pus or maybe do some surgery. So that's myringotomy. And then we perform something called a tympanoplasty, which is, remember, plasty, surgical repair of your eardrum, okay? And it's usually a chronic inflammatory process or chronic middle to inner ear infections, but it also could be for people who listen to really, really loud music. And man, there were times at a club, there would be like 105, 110 decibels in a very closed space. Not good. Autoria is discharge or flow. Now, if you see anything coming out of anybody's ear, fluid-wise, you have to note down what came out. Because if it's clear and non-foul smelling, it could be cerebrospinal fluid. And the doctor needs to know that. How many times when I was in ENT, right, we have to refer back to neurology. And then maybe the nurse or the tech was like, yeah, I saw her shirt was wet. And I go, excuse me? Yeah, right here, right at her neck. And I go, no one told me anything. right? Because many times, when they call you guys frontliners, right? It means you have to be there up front and paying attention so you can relay information to me. It's useless if you keep it to yourself. And many times, the tech or whatever had a nice little tidbit, but they were thinking, well, I'm not a doctor or I'm a nurse, right? Yes, but you're a medical professional and you're trained to look at things. And does that look normal to you that a person's shirt should be wet on one side and you could see that it's coming from their ear? No, that's not good, right? We actually, one year, an 8-year-old boy died because of, he was sent home because they just thought it was cerumen that was coming out of his ear, like, what do you call it? Earwax, impacted earwax. But the physician who was looking at it was like, oh, no, it's just clear fluid. It's no big deal. But clear fluid that doesn't smell, that's a problem. Many times, usually if it's foreign body, it might be a clear fluid, but if it's foreign body, it stinks, right? It has that, earwax smell. I can't describe it. It's one of the many smells of children that I don't like, that you as parents know that smell. When your kids don't clean their ears for a while, it's that waxy, snotty buildup smell in their ears. And if you smell that on their shirt, there's something up. And we typically take hydrogen peroxide and then we douse it, and it's really neat. We take this vacuum and we just suck all of that stuff out. It's the craziest thing. Part of me, yes, but then at the end of the day, when you can't get that yucky feeling off your hands, even though you had gloves on, and you can't get it out. I have stains on some scrubs, some old scrubs from my ENT years when I was an outpatient, that I'm like, this is just cerumen, just earwax. This shouldn't stain my clothes irreparably, but it does. So autourea, be careful, and especially if it's blood, right? When I was in EMS, how many times we misdiagnosed that? We thought the blood was coming from the head, and then you look, it's coming from their ears, and that could be a potential sphenoid or basal fracture. That's not good. Now, your fallopian tubes, salpingo, we already know that. Pharyngeal, your pharynx, right? Now, in this ENT example, salpingo means your eustachian tube. Now, what's your eustachian tube? Now, all of us have been, or I can't say that all of us have been on a plane, right? And here's your eardrum. Here's your ossicles, which is the smallest bones in your body, if ever you want to win Jeopardy. But I think they use that. So this is what happens. Blah, 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 right? My sound waves come in here, and they hit this, which is your eardrum, also known as your tympanic membrane. And then it shakes up these 3 tiniest bones in your body. It goes through this thing called an oval window, and then it goes into your cochlea, where they have hair cells, and there's fluid in there called your perilymph. Now, the fluid, have anyone ever yelled at water? Well, I have such anger issues that I've done so. I've yelled at beer, water, and the aberrant orange juice. But you'll see what happens if you yell at the fluid. It'll shake, wouldn't it? That shakes, then that movement then goes into your vestibulocochlear nerve. So what you're hearing right now, right, you might think this is the golden cherub voice of Dr. Garais. No, it is your representation of what you think my voice sounds like. That's why when we're in the shower singing to ourselves, you come out like, damn, I should get a record contract right now. And your whole family is like, oh, sweet heavens, are you done? It sounded like you were strangling cats, right? Because this, right, of course, your head is also the best speaker in the whole world, right? That's what you're really sensing. You're sensing just sound waves, but it is your brain that interprets the sound waves. Now, when we're on an airplane, right, this is deep inside your skull. There's going to be pressures, and the pressure has to get released, and that's where this eustachian tube comes in. and that releases the pressure. That's why, when you sneeze on a plane, or your ears pop or whatnot, and your ears kind of hurt a little bit, right? But then you chew gum and then swallow, and then it boop, pops out. Well, don't you think also this is a point source for infection, also known as otitis media? Otitis, inflammation or infection of your ears, media, the middle section of your ear, and this is your inner ear right here. And doesn't that start off the same way? The kid always goes, I got a sore throat. And then the next day, Mama, my ear hurts. Or there's something in my ear. And if you're one of my kids, I think a cockroach went in my ear. And I'm like, oh, sweet heavens, I'm not looking in there. Right? Of course, I got to go look. Actually, that happened just the other day. My daughter was working out, and she had she said a marble fell out of her ear while she was on the treadmill. So now I had to bring home an otoscope to see what the heck's going on. She said like a marble or a pebble, a rock, fell out of her ear. And if you looked at really cerumen that's been in your head for a little while, it's not yellow anymore. It's almost black, brownish black, right? So maybe my daughter isn't cleaning her ears.
So I have a question.
Yep, shoot.
So like say if you get like a sinus problem or something, and you know how you get that.
Yep, it's the same thing.
Thing in your ear, so that's what it's.
Because if you remember, we talked about upper respiratory tract and lower respiratory tract. Remember, your sinuses are part of your upper respiratory tract. And now that I introduce you to the eustachian tube, now you know your ears are connected to what? Your pharynx. So if you have an upper respiratory tract infection, like pharyngitis, like a sore throat, don't you think if it gets out of hand, it'll go up into your ear? Especially those of you who swim. When I used to swim, I used to get it all the time. Because, that water, it's sloshing around in your mouth, it's sloshing around here. And then when you breathe and when you force breathe out and stuff like that, when you're doing laps, it creates different pressures, and then it could shove water in there. And what happens when water stays stagnant, right? Especially mixed in with all the bacteria in my mouth, which is the nastiest place in the world. Not my mouth, but mouths in general, right? Yeah, I always say that. Remember, the mouth is way dirtier than your anus. Your anus, I'm only thinking about E. coli. Your mouth, I'm thinking of 250 other things. Think of it this way. You fall in a sewer, nothing happens. You clean yourself off, and I call you stupid. You don't need to go to my ER. But if you punch somebody, right, and you cut your hand, you get a tetanus booster, you get prophylactic meds, and I have to now do a wound culture on your hand. And then you have to come back in 5 days after broad spectrum antibiotics, and then be on another set of antibiotics for another 7 days on top of the tetanus booster. That's why the stuff up here, that's why your stomach has to have an acidic environment, because no matter what you eat, no matter how clean it is, your mouth is not clean. You could brush your teeth all day. It has all these lovely, lovely bacteria. Because what is bacteria like? It likes dark, wet, and warm. What do you think is in between your teeth? Dark, wet, and warm. So, and that's assuming you brush after every meal. Who brushes after every meal? Right? I think I have like the worst teeth ever. I'm really trying, even though with all this oral surgery, I'm just really trying. And I'm like, and by the way, you know that yellow stuff, the plaque? Now, for the last 10 years, we've known this. The plaque causes it's the same bacteria that has a direct correlation with heart disease. So yeah, you can get heart disease by not taking care of your teeth. Yeah. And with my history, on top of all the Doritos I eat, am I not asking for trouble? I'm asking for it. I could run, and my mother reminds me, you can run on any treadmill, but until you get your other lifestyle issues in check, all that time on the treadmill is useless. And I'm like, whatever, little lady. And he goes, we've always had fights. Me and my mom actually had a fight earlier. He goes, you're not the only one at the MD. And she always says, well, I'm the only one using it. Yeah, we're like, oh man, I'll be the first one to, is this thing on? Am I recording? Because some of this stuff is going to get back to her, and it'll never be a good thing. Tympanocentesis. Remember what you said about that stuff that is in my daughter's ear? There could be stuff in there. I might, if there's fluid or pus, I might have to go in there and surgically puncture your eardrum, because there could be fluid, pus, blood, heaven knows what's in there. And if there's fluid, pus, or blood in there, will the eardrum vibrate? No, it won't. So that's a problem.
Would that damage your hearing though?
Oh, it would damage. If you cannot vibrate your eardrum, you can't hear.
But with the tympanocentesis, if you
The
do the
tympanocentesis.
tympanocentesis,
Mhm.
if you do that, does that damage your hearing?
Yeah, it does, but at least I have to get the thing that's offending my eardrum out. And then we do a tympanoplasty, we sew it all up, and then, you know, we let you, I think it's like 6 months. Another DJ friend of mine, he had a decent tympanoplasty done. He wasn't allowed to listen to music or do anything. He had to wear these noise canceling headphones for 6 months. And then after that, he wasn't allowed to do anything. And here's the unfortunate part. He is a national DMC champion, and he that's his life. And this was pre-COVID. So that was a tough year. And then a year later, COVID happened. Now there's no clubs, there's no things and nothing. You know, it's you don't know what the world is like as an adult. Remember when we were kids? I want to be grown so I can ride the rides. Well, you know what? Now that I'm an adult, I want to get off. I don't like it. I want to be back to like toddler age. Just feed me my oatmeal and call it a day. I just play with my Legos. And then you can see here, here's another view of it here. Lovely, lovely picture. Oh, by the way, this thing's called your pinna, also known as your auricle. You don't need it. So I could chop this off and you could still hear perfect, right? So it makes you ask, what's this for? And my answer is it's fashion for your earlobes. You know, if maybe you want to put something in there, or to hold up your glasses and your mask. That's about it. Oh, here, right? And this is a lovely otoscope. And gang, if your physician doesn't throw these tips out, there's some physicians, they like recycle them. Yeah. I don't know what, I mean, yes, you can do it in theory, but man, pay the extra $20, jeez. Right? Actually, when I was in the office, I cleaned this thing before and after every patient for obvious reasons. And now, COVID times, they now have, if you're in an internal medicine office, they have more than one kit. So it goes back and forth, back and forth. Ears, more ear stuff, ear. We already went through all of that. Okay, let's look through some of these lovely abbreviations. AMD, you'll hear it, age-related macular degeneration. That's when the part of your retina, and this is not normal, okay? When you get older, yeah, you're gonna lose some of your vision in presbycusis. It's gonna wear away, but it shouldn't get to the point where your retina starts falling apart. So this is not good. Astigmatism, I've never seen it, AST. ECCE, I've seen extracapular cataract extraction. So your capsule, which is your eyeball, extra, I'm removing it. I'm extracting it out. IOL, intraocular lens, IOP, intraocular pressure. Now, maybe you guys will have heard of glaucoma. Maybe you have some family members who may have that. Well, your eyeball is filled with fluid, but it has to be a normal level of fluid, because if it's too much and the intraocular pressure gets too much, right? Too much of a good thing, what will happen to your vision? You can go blind, because too much pressure will start pressing on your retina. And we now know that you shouldn't be pressing on a nerve. It's never a good thing, right? IVFA, intravenous fluorescein angiography. Now, what does that mean? Remember I showed you, you know, the otoscope and the Cottonwood Spots, right? You saw all those arteries and veins, right? Mostly arteries, right? You can see even more with IVFA. And this is what we do. We put stuff that'll make it like glow in the dark. We put stuff into your IV, and then it'll run throughout the course of your blood. And then when we look through this thing called a slit lamp, and that's like the super, you know that thing that the doctors do, and then it shines this very, very bright, thin strip of light on your eyeball, and it kind of hurts. For me, it kind of hurts. Well, I'm a big baby about it, but you put that with the IV fluorescein, you could see specifically the pathologies, even more so than you would with the ophthalmoscope. LASIK, of course, laser assisted in situ keratomileusis, right? So that's LASIK surgery, okay? In situ, meaning what? We're gonna do it right there, right on your eyeball. That means I don't have to cut open. I use a laser, and it's really neat because a laser, you can control its size, its length, so and it's very, very accurate. And we use it for astigmatism and presbycusis. We use it for a bunch of things. Muscular dystrophy or macular degeneration. No one calls it MD because, what do you call that? MDs are what? Doctor of medicine, so it'll confuse somebody. Doctor of optometry, your OD. Now, do not confuse that with your DO. Your OD, doctor of optometry, they're the person who are going to develop your lenses, right? And or advanced lenses especially, and also they also deal with a lot of the technologies for vision. And also, what's a DO? DO is the doctor of osteopathy. Those are the people who are like MDs, but it's just weird. So if you see a DO, think of it like an MD. You think an OD, think advanced person who has a doctorate, not in medicine, but in making your, measuring your eyes and making your eyes. And that's the person who probably runs the laboratory for all the diagnostic stuff. Many times you go to the place, there's a laboratory and then there's the doctor's office, right? You go through all the laboratory and the technicians, and then they shuttle you off to the optometrist, the ophthalmologist, right? The people who saw you first are the optometry people. The OD runs the entire lab, right? So it's the lab and the doctor are kind of like two separate things if you've ever been to see, get your glasses and stuff. Perla is pupils equal, round, and reactive to light and accommodation. That means when I flash, I dim the lights and I flash a flashlight in your eye, in your left eye, that means your right eye will react. And if I do that with your right eye, it'll do the same thing. So they're equal and reactive to light, and they accommodate. Right? If it's too bright, the pupil will get very small. If it's too dark, the pupil will get bigger. All right? And so if they say ENT Perla, that means ears, nose, and throat. The eye portion is what? Is all good. And RKVA, visual acuity, and that's the vision 2020. And what does 2020 really mean? 2020 means on a Snellen's chart, which is, the eyeball chart here. When you look at the chart, 2020 means at 20 feet, you could read this red line. That's what it means. Okay? And that means you have normal or emmetropic vision, 2020, right? Now, when the numbers start getting off, that means, and you'll learn that in your clinical classes. Now, ears and eyes.
I have a question.
Yeah, shoot.
Like when it's in the negatives, what does that mean?
Like when they start doing stuff like 30-20 and -10, it's hard to explain. It's like let's say you have crappy vision like I do, and you have 10-20 vision.
Mm-hmm.
If you have 10-20 vision, it means you need 10 feet, what a normal person can see at 20.
So negative is even worse.
Yeah, negative is like.
Yeah, I'm like -6.
Like negative is like you need to be standing next to it,
Yeah.
right? But just know that you'll see when you're in your clinical class. It'll make more sense because I'm just giving you an example of 20/20 vision.
Mm-hmm.
Now, what's the difference between a cataract and glaucoma? Now, glaucoma we already talked about. Increased intraocular pressure. Too much pressure, it's going to mess with your eye. And cataracts is when the lens gets all foggy. The lens is supposed to be clear. And when it gets all foggy, either due to old age or diabetic retinopathy, or not retinopathy, but diabetes, sugar is a very large molecule. Just imagine it running over something nice and clean like your lens. And it scrapes it, this nice 6-carbon sugar. And then it just sits there, right? You guys know what happens when you get a stain on your nice china, right, after a party, and you're like, yeah, I'm just gonna leave it there. And then the next morning you try to clean it, it's gonna stain, it's gonna get crust in there, and that's what happens in cataracts. That's why when we start seeing cloudiness or when our patient starts complaining of blurry vision, we have to now act and now start doing something, right? But it's usually when, you know, she looks like my grandmother's sister was like that. With all the, me and my mom, we're both doctors, we're both yelling at her. She got to the point where she looked, you know, she looked like a demon because she was like all white. And we were like, Nana, what up, man? She goes, I can still see. And she'd be lying to us, like bumping into doors and stuff. And she's like, I can still see. I still see better than you. And like, now, no, Lasix would be for corrective vision. And no, we actually take the cornea out. We chop it out, but we can use a laser. For eye surgeries, we like laser because they're bloodless. Because if you use a scalpel, it might hit something and cut something.
So for cataracts, they slice it off too, or take it off?
Yeah.
Take it out too?
Yeah, we take it out either with a scalpel or a laser.
Oh, okay.
And it's a little bit like microsurgery. And ironically, it's the only surgery I ever fainted on.
Really?
Yeah.
But it probably looks crazy when you.
No, I think because I had hypoglycemia and I didn't eat for like 3 days.
That should be a reason.
But it was funny, when I woke up, they were like, okay, you can go back into the surgery, you can finish off the surgery. And then right before I walked in, oh, by the way, you have a 0 for the day. And then I'm like, but I fainted. And I go, exactly. He goes, just imagine if you fainted on the patient or on the equipment or anything. Lucky for you, you fainted backwards. And I'm like, welcome to medical school, people.
Oh my.
That's how it is in medical school. They're just
So it's
brutal.
true that doctors are more squeamish than anybody.
No, doctors are no better than anybody. I know some physicians who are like, especially if you're in a clean service, like, what's a clean service? Radiology. What do they see all day? You know, they see pictures and films and things like that. They don't get really dirty like pathology. Pathology, oh my goodness. When you do a bowel prep, it smells like homeless toilet times 20. It is the worst smell. If you don't throw up on that, there's something wrong with you. But let me tell you, after 6 months in pathology, I got in trouble because me and the nurses were eating hot dogs while we were doing an autopsy. During bowel prep, the nastiest thing in the world, right? I was chomping down on a hot dog with no mask. Because it's amazing what you get used to. But for whatever reason, never fainted on that, never fainted on anything in the ER. I wanted to vomit. Oh, I vomited maybe dozens of times. But for whatever reason, in my final ophthalmology laboratory class, I was supposed to assist on cataract surgery. I prepped and we cleaned everything and we did everything and I was ready. And about 5 minutes in, for whatever reason, I felt the curtains close, right? And then the next thing I know, I'm in the residence room and the nurse is like, you get to go back. And I go, what happened? Who hit me? Because that was my first thing. I had a bump in my head. And I go, did someone hit me? Right? It goes, no, yeah, the floor hit you. And then I'm like, okay. And I went back and it was funny. Right before I got in, the nurse proctor said to me, oh, by the way, Nelson, you have a 0 for the day. You're going to have to do this again next week. Then why you letting me go back in, lady?
Right. Let me go home.
No, because it's my responsibility. I'm there to be the first knife number 2, assist, and that's what I came to do. Right? So you finish it out, you got the 0, you sucked it up, and then you talk to the physician, and I was begging her, please give me 50, and then I'll do maybe a paper and another assignment. She goes, no, we're giving you a 0, and then you have to come back next Tuesday. We'll just do another one. It will be okay, Nelson. Just don't faint again. But that afternoon, I made sure I got a Big Mac and some fries. I made sure I had some food in me. Now, let's talk about this abbreviation thing here. Okay? And let's see if, hello, Microsoft Word. Yes, it's verifying. It's me. I paid my bill. Don't you love that with software now? They're verifying that it's you, that you paid your bill. Man, I remember for decades I had like fake Microsoft stuff. Again, is this thing on? Is this thing on record? Because I better just shut up already. Now let's look at right versus left. Okay. Now, oh wait, right, left, and both. Okay. Let's get this right now so no one gets confused. Now, if it's right, it's dexter, so it's D, right? And if it's left, it's sinister, because it's, lefties are evil. That's how I remember it, right? Back in the old days, for all you Roman Catholics in the room, by old days, not even 60 years ago, 60, maybe 70 years ago, Catholic schools, if you're lefty, they forced you to write with your right hand, which is really creepy. So if it's anything right, it's got to have a D in it somewhere. And if it's left, it has an S in it somewhere. And both means universal. So when universal means what? Uni, one, it means everybody. So let's talk about ears. Ears are aural, A-U-R-A-L, yes? So if I have A-D, is my right ear, A-S, my left ear, A-U are both my ears. No one's going to get this wrong, yes? Nobody. Okay. Now, if I'm looking at my eyes or my optics, right? Right is what? D. So it's OD. Left is OS. Both my left and right eye, OU. Let's keep that there for a second so everyone gets that down, because this will definitely be on your final somewhere. Because this is the most messed up thing on why JACO, or the Joint Commission on Hospital Accreditation, hates abbreviations. Because can we easily see how this can mess people up? This has messed me up more than once as an MA, as an office manager, as an emergency medical technician, as a doctor. I've messed this up how many times? Because I forgot that aural means your ears. Eyes are O, and that's what an eyeball looks like, right? So if I could ask you, please put 5 drops of this medication, AS, right? Stat, or right now. It means you will do the 5 drops where? No, AS.
Oh, AS.
Yeah, see? Yeah, see? See, someone did it.
On the left.
My stories are real.
Wait, so D stands for Dexter?
Dexter.
Dexter?
You know when you're you have dexterity? Dexterity means what? And most people are what? 65% of the people on this planet are right-handed.
Right.
So that's when they say dexterity. You're dexter, which is your right. Sinister, which is what? Sinister.
The left.
The evil.
How do
The
you
evil
spell
left. Sinister.
that? I mean, not sinister, Dex.
Dexter. But that's the Latin part. But I'm just giving you how I remember stuff. But if you look at it like what I just drew it right here, you remember it that way. I'm sorry if I'm doing all the Latin stuff.
Oh, that's funny.
Someone was speaking Latin in a movie, and I knew what they said, and my daughter thought I was a genius, and I go, no, I just remember all the stupid stuff.
So how was ambidextrous?
So if someone was ambidextrous, ambi means what? Just like amphi, both.
Oh,
Like my eldest son and my 14-year-old. My 19-year-old son and my 14-year-old daughter, they both can write just as proficiently with both hands. Even before he was in the Corps, my son can shoot both ways. And my 14-year-old, I teach her boxing. She fights. She can fight southpaw or regular. That's why sometimes when I'm doing mitts with her, I get confused because she switches her feet, and I'm going left foot, and then I forget. Oh, you're lefty. My bad. Right. So when I call ones and twos, threes and fours, and oh, by the way, that's all you need. That's all you need is your jab, your reverse punch, right hook, left hook. 1, 2, 3, and 4. You don't need any of the other stuff. You could do a lot of damage with just those combos. Actually, in many martial arts, you only need what? 1 and 2. Right? Who does all these combos? What are you, Ryan Garcia? No, just very, very basic. Again, I digress. So, we get all this down? Everyone at home? We're all good? So, with that being said, let us now look. See, and then cataracts. Thank you for asking that question. You already preempted us. And you could see, right? It's not really connected to any arteries or veins, so I could just cut it off. Diabetic retinopathy, very, very dangerous. Uncontrolled diabetes within 5 years. That should scare you that we know the timing. That we as medical professionals know the timing. The second you get diagnosed, you got 5 years to go fix yourself, or you're going to get blind. And that's diabetic retinopathy. As in legally blind, you won't be able to drive. You won't be able to look at your computer. There's some serious stuff. And my father, when he was alive, was one of those people. And I don't need to go over this stuff. And you can see your eyeball is essentially 2 rooms. You got this jelly room in the back, and then you have this water room in the front. And then you got your lens here, and then your cornea, this clear shell here on the outside. And all its function is to make sure that the light waves end up here, in this yellow part back here called your retina. And then the retina then sends the signal to your optic nerve and then to your brain. So like I stated before, everything that you're seeing on this lecture, everything that you're hearing on this lecture is a machination of your own mind, right? Your eye doesn't see anything. Your ear doesn't listen to anything. It's your brain that does. And here's that strabismus that we were telling you about, the movement of the eye. Esotropia means you're like you're cross-eyed going in, towards your nasal line or your midline, and exotropia means you're it'll be facing away from your midline. So if you see here in A and B, the affected eye is the patient's right eye, right? So here, cross-eyed this way, here, wall-eyed this way.
What do you call it when they're both like that?
When they're both like that, you call it bilateral esotropia or bilateral exotropia. If it's only one side, unilateral left, unilateral right, or esotropia esotropia OS or esotropia OD. So that's how they talk. Here's that slit lamp that I was telling you about. Why does she look high? I don't know. You're supposed to get the meds after, but whatever. But you could see how the doctor looks through here and it shoots a very thin, concentrated beam of light. And you could see like the sides of your eyeballs, and it's a very, very neat, very, very neat thing. I've only done this like half a dozen times in my life when I was in Opta, because I don't know, they just didn't want me to touch the really, really expensive machines. By the way, ophthalmology is one of those things, if you can get into that business, you plop down maybe 3.5 mil for all the equipment. You'll make 10 mil the first year out. But yeah, because think about how many people need glasses on a regular basis. Think about Medicaid, Medicare picks up for all those things because it's an essential thing of your life, right? So charge them whatever you want, and you get 80% of it. But out of all my classmates, only one of them, and he wasn't a rich kid, but he begged, borrowed, and stole to do everything in his power. And he's now in like North Dakota in the middle of Bumbledog nowhere, making money hand over fist. While the rest of us are like, he was like, hey, why don't we go to Hawaii for a reunion? I'm looking at him like, no. He goes, how about New Jersey? How's that? I could drive there. Here's a Snellen's chart, right? And remember, I forgot it was the green or the red. That's 20/20 vision. And that means you could see it you could see that particular line at 20 feet. Oh, this is a Renee Weber test. That's a tuning fork, because you not only hear with your ears, it's your head that is the most beautiful speaker, and it picks up a whole bunch of things. And how do we know? You mentioned sinusitis about 20 minutes ago, yes? What does the whole world sound like when you have an upper respiratory tract infection? And it's like, what? What? And you get really annoyed, and you're thinking it's your hearing. No, it's your head is all stuffed up with pus or God knows what. He's looking at, yeah, what's next? It's probably some nurse going, man, the things I got to do to get my grade in this class. Okay, and this is macula or your macula densa. This thing starts falling apart. It's an indication of retinal degeneration. Mac degen or macular degeneration is a serious thing. It's the first step towards blindness. And once you're blind, can you get it back? No, you're done. Once you are blind, you are done. You cannot get it back. Rectomy.
Looks like a bad full of pink eye.
No, this looked like all the blood vessels popped, and there's a multiple reasons I don't want to get into, because I don't. First of all, I'm not ENT, not opto, so here's that ear irrigation what I'm talking about. And remember all that cerumen, the CERUMEN, that's earwax. And earwax in a normal level is important because it picks up viruses and dirt and whatever, but you got to regularly clean it. And again, when it starts getting dark brown or black, that means it's been there too long. It might get infected. And that's when you had like my daughter complaining about she was running on the treadmill, and then when she turned her head, a pebble fell out of her. And I go, where's the pebble? And she goes, I don't know. It's on the treadmill somewhere. I'm not going to go get it. And I'm like, so it was kind of weird. We were in the treadmill today looking for rocks that may have came. And I told her, I was making fun of her. You know what came out of your head? Rocks. Because that's what's in your skull. Because you're stupid. Again, is this thing on? Because they're going to get me. So last but not least, what are we doing? What is with these actors? What? This guy, he's looking at me sus. Like, hey, you doctor? This is what you guys know, that you guys are in the medical field. This is what we have to put up all day. You doctor? You nurse? I don't talk to anybody but doctor or nurse, and they look at you like this. Like you don't know what you're doing. Trust me, it doesn't change. Even when you have an MD, even when you have a title, right? It doesn't change. There's always one who's gonna look at you like they're angry. So Henry Holler. Why do they call him Henry Holler? Oh, come on, man. Can't they give him a normal name like Jones? Now, if I have something like this, just as a little precursor, and I already put the practice exam up, so look at it, and it's practice, okay? So just like the NCLEX, I'm going to give you one of our many things like this, and I could just ask you things like Mr. Holler, he had total retinal detachment. Was it OS? Was it was it OS, OA, OU, right? So it was left eye, so it was what? O-S. There you go. See, you guys are getting it. What happened? Did he have cancer? Did he have inflammation? Or did he have macular degeneration? And you see here, retinitis. He had inflammation. And his retina, which is not a very good thing. So these are the kind of things. Or I could ask, who's Kathy Cannon? Right? Since this is what? An operative report for the Department of Ophthalmology, Dr. Cannon is what? She's an ophthalmologist. So do you think I could try to trick you? Ophthalmologist, optometrist, DO and OD, right? You're going to want to say the other ones, right? But now you know, wait a minute, this is ophthalmology. So, and for those of you who I told, like I made the comment, like you're making a generic quiz, right? Like what is the meaning of the word retinitis? That's not what this exam is. This exam is kind of prepping you, because you guys are already pros, okay? You guys already know what the prefix is and all that, all right? That's baby stuff. We're now getting to how you look at cases and how you communicate in the real world, okay? Because the doctor or the nurse will ask you questions, and you better be able to answer them, based on your medical terminology powers. So when I make a comment to you that you're not being specific, like some of you would like, oh, what's the meaning of the word retinitis? That's not specific to this case. What's specific for you? Oh, Mr. Holler, did he have left or right? And what was it due to? That's being specific. That's the kind of questions. And if you look at the examples that I gave on the practice exam in announcements, that's the one, that's the ones that we're looking at. Okay, it's at this point of the show where I am going to stop recording. Now that I've